This is not a reel, not a podcast, not a TED talk. Just me, my coffee, and one story you might need to hear. Because the internet is flooded with half truth, full volume lies, and zero space to pause. Nobody listens, nobody slows down. So, this is for whoever still knows how to listen. I'm Dr. Samir, an orthopedic surgeon, trained across India, South Korea, and few other countries that stamped my passport, but didn't prepare me for this. I've been around the world and I'm still dealing with this nonsense in the small town where I practice. So, a 65-year-old farmer walked into my OPD, poor, diabetic, with an ankle wound that's now infected. He didn't show up early because he applied oils, pastes, some leaves, some turmeric, everything on his wound except science. Now, the wound is foul smelling and neglected. We have to clean it, wait, again clean it, maybe 3-4 surgeries, maybe a skin graft is needed for the wound. And while I was explaining that to the patient and his relatives, a man walked in, well dressed, confident, shoes polished, shirt tucked. The kind of man who walks like every corridor is a press conference and speaks like his words should be printed in bold. He did not introduce himself. He just arrived with a posture of a Robin Hood savior and the entitlement of someone who thinks presence is contribution. He said, "This guy is poor man. You must help him." I said, "I am helping. That's why I'm being very honest with you." He asked how much this operation would cost. I said, actual cost is around 15 to 20,000 per surgery and he will need 3 or 4 such surgeries. He paused, then said, "That's too much. He cannot afford it." I said, "Yes, absolutely. So maybe we can meet halfway. I'll reduce my surgical fees as much as I can. You'll still need to cover OTUs, dressing materials, antibiotics. But I will definitely cut my surgical charges." He said, "Okay, but what's the package?" I said, "This isn't a package deal. Even if I lower my cost, the body won't lower its demands. We still have to do 3 or 4 surgeries." Then he said, then he thought and said, "Can't we just do it in one surgery?" I said, "This is not a clean fracture, it's an infection. This isn't like painting a wall, like you just paint it once and then walk away. It takes repetition, monitoring, patience, because infection doesn't follow your schedule, it follows its own." He said again, thinking, "At least tell me a fixed number, like what's the total package?" Okay, right. I said, "Let's say I give you a package of rupees 50,000. What happens if the infection doesn't settle? What happens if he needs the 5th surgical procedure? You'll come back and say, why did the budget go up? Since we agreed on 50,000. So, operating is not like a phone recharge plan. You can't recharge it once and expect unlimited healing. I also told him that if this happens to me, I would have to go through the same steps because biology doesn't care who you are, and neither do I. Because here's the truth. Even if I operate for free, you still need dressing material, sutures, injections, antibiotics, gloves, surgical equipment. Those things do not fall from sky. Even in my hospital, those costs are real. Now imagine I say I'll make tea for you. Sounds generous, right? But to make that tea, I still need milk, sugar, tea leaves, and water. If I have to buy all that from the market, it's not free tea. You're not paying for my time to stir the pot. You are paying for the ingredients also, and that's how treatment works. So I told them, if this feels expensive to you, you always have the option of going to a government hospital. And if you get him admitted there properly, even if there is no surgeon, I'll come and operate him for free. Well, that's one way. Or you can admit him here, Pay only for the things needed to run the operation theater. Forget my fees. I won't charge for it. Because I don't work for money, but I don't work for guilt either. Still, they didn't agree. They didn't understand. Because some people come with questions not to understand, but to argue. He didn't get it. Not the wound, not the infection, not the logic, because he didn't come for logic. He came for control. He didn't want to help the poor. He wanted to feel like he did, and he needed me to make it look real. He didn't come to solve anything. He came to be seen solving it. And that's more dangerous than any infection I have treated. And that's where I drew the line. I didn't admit him. Not because I didn't care, but because I saw what was coming. If someone can't respect during your OPD consultation, they will never understand what you do inside an operation theater. So I said no, because someone had to. Not to the patient, but to the Robin Hood politician who wanted a shortcut. I told them, you will find doctors in government hospitals. Maybe not easily, maybe not quickly. But if you find, you can always operate there for free. Because I care for patients, but I won't barter empathy for exploitation. So this one's for you. Don't waste your energy trying to explain biology to people who come with politics. They don't want to understand you. And if they can't understand you when you have not even touched the patient, they will destroy you when you do. Because when their shortcut fails, they won't blame their logic. They will blame your hands. This was never about one surgery. It was about how people assume that care should come at the cost of the one giving it, and I refuse to be that cost. Asking for package isn't wrong. Expecting fixed rates for unpredictable biology is wrong. Surgery is not like going to a market and buying a dozen of bananas for ₹40. You can't bargain with infection. You can't haggle with healing, and you definitely can't MRP your way through a complication. So don't be shocked when the infection says, sorry, I'm not the part of your package. I didn't operate on that man, not because I didn't care, but because they didn't get it. I said no, because someone had to say no. And for the record, free service does not mean free resources. This is not ego, this is clarity. And it took me years to earn it.